Not necessarily. The only thing is I do think that my range of motion, especially like in my hips, were limited because I was after a big
During
lift.
the last exam?
Yeah, it was after a big lift, and so I was pretty sore in my adductor area.
Yeah.
So I feel like I was doing some stretching over the weekend.
So you feel like you'd be more mobile today than you were during our
A
exam?
little bit more, yeah. But right now my hamstrings are actually sore because
on both sides?
No, yeah, both legs.
Okay.
My hamstrings are sore because I did something Friday. That range of motion will be limited today, but
Yeah.
like as far as my hips go, like my hip mobility seemed to be better than what it was when we met last week.
That's great. Well, maybe 2 tests that were really key last time that we can look at right now. So if you just kind of square up with me on that chair, this one was called extra coxa, where without lifting up much, you're gonna purely rotate your hip this way. Good. I'm just gonna keep a limit on this, so don't go any higher than my hand. Good. And now pure rotation. That's left side. Let's check that on the right. Keep this a little lower to there. I think what you're gonna find is that barrier. So if we compare this angle compared to what we can get to on the left, it's still a deficit on the right.
Sure.
And then the second part of that, when you cross your legs here, you're gonna use your glutes. Use your glutes to squeeze the knee down until it's parallel while your posture's off the back of the chair. Good, and ideally, I want that to be closer to parallel with the ground. Let's see the other side.
Definitely less on this side.
Yeah. So I think it does look like it's moving a bit better, just like after your delayed onset muscle soreness dissipated. But the findings there still kind of hold true, so we'll be able to address all of that today. Any other questions you had?
Not really. Also, actually, one more. What's the process with the electroshock therapy?
The shockwave therapy. Yeah. So usually when we put that together, it's 8 sessions that are once per week. We usually add that to the beginning or the end of the other treatment that we're doing here. And for 30 minutes, we use 2 different machines. The radial shockwave therapy sends a pulse that goes about 2 inches deep, and it uses that mechanical force in the muscles and the tendon. And then the focus machine, we position that more over some of the degenerative changes within the shoulder. That's going to target like the little bone spurs that are called osteophytes, and it's going to treat those specifically as well as some of the deep structures. So that part of the treatment lasts for 30 minutes, once per week for 8 weeks. But the healing phase is between 8 and 20 weeks. So even after we stop doing the treatment, your body will still be healing for a few weeks after it.
I'm kind of interested in that. My mom was telling me about how she's doing.
Yeah, she's done great.
She's already noticed results after like 4 sessions.
I think there were some results for her right after the first session, and then it's gradually building up from there.
Okay, cool.
So yeah, that's probably not scheduled to do that today, but if we'll confirm with your parents and get a confirmation on that, we can set that up.
Yeah, for sure. That
Cool.
sounds great.
So for today's treatment plan, you're going to start with me in here. We're going to use chiropractic adjustments to loosen up the mobility in your spine and your hips. I'm also going to show you a nerve exercise for your arm. It's called a median nerve glide. Then we're going to work with Katie on loosening up some tissues, and finally with Liz on some exercise.
Okay. Cool.
Let's slide the shoes off, and I'm going to have you lay face down on this table.
All right.
Okay. We're going to bring your arms down by your pocket. So essentially what a chiropractic adjustment does is finds a stiff area like this where the joints are supposed to be mobile but don't have that springiness anymore. And it uses a quick but shallow amount of force just to restore your normal motion through here. It's always more comfortable when you fully relax. That means I don't have to use as much pressure. And you might hear a pop or a click. That's nothing changing in the bone. It's actually just a change in the pressure inside that joint that creates that click. Okay, so here's our first spot. Go ahead and breathe in. And as you exhale, you're gonna feel me just lightly pushing in like this. Okay, we're gonna do that one more time, but we're gonna add a little bit of force to it now, okay? Breath in, and relax all the way out. Great. Next spot, breath in, and relax all the way out. Wow. Feeling okay with those?
Yeah, it's interesting.
All right. Okay, we're now going to check the rotation in the lumbar spine. Just like we did for the thoracic spine, there's a certain amount of motion that each joint is supposed to have in order for your muscles to move you around without too much force. And like for this in your lower back, there's a limitation in this rotation. So we're just gonna restore that rotation with the next adjustment. So I'm gonna have you lay on your side facing this wall over here. And I'll have you bring your pockets right up to the front edge of the table. So your bottom hip, just set it right at the front edge.
Okay.
That's perfect. And I'm gonna roll your arms like this. Your bottom leg's gonna be straight, just like that. I'm gonna bring your hips a little closer. Okay, my hand's gonna go on the skin of your low back. I need your hips right up at that front edge. There we go. This leg's gonna be right there. So I'm gonna pull up on this joint, and you just kind of relax in that position. Then I'm gonna be pushing down with your hip, and that's gonna help us rotate your back. Good. Let's go to the other side. What are you noticing with that?
That was weird. A good weird, but
Yeah? How so?
weird. It just felt like I was like being like pulled kind of
Yeah.
out of everything. I don't know how to
makes
explain
sense.
that,
But
but
it felt like a release afterwards.
yes, definitely.
Let's bring your hips right up to the front. Okay, so this one is similar setup, but this time I'm gonna put my chest on top of your hip, and it's gonna help your sacroiliac joint move.
Okay.
So we're gonna roll your hips to there, and bring you a little further forward. And roll your shoulders back slightly. Great, okay. Let's have you sit in this chair now. Okay, we're gonna check into your neck now. Okay, you're gonna slide your hips forward so that you're kind of slouching on the chair. That's good, and then you're gonna lean all the way back. So I'm gonna move your neck, just try to keep the neck nice and relaxed while we check in on the joint motion. Is it sore through here?
A little bit.
Sore on the left side?
Not as much as
Not as
on the
much, yeah. Go ahead and slide your hips even further forward. Get nice and low on the chair. Okay, so this is the key joint that we're gonna be adding motion to. It's C1 to C2. I'm gonna place my hand right there and you're just gonna lean back against me. And we're gonna lean this way. And I'm gonna push into the joint like that. Do you feel relaxed in that position? Okay, just lean back against me. And with your eyes, just look up to the left. Great. A lot of ropiness through your neck muscles. As we start to build up a little better exercise through there, that's gonna loosen up. Okay, back to the table. I'm gonna have you lay face up here. An adjustment a little bit lower here.
It doesn't like hurt, but it's like
It's a different feeling.
yeah, it's like it's not pain. I don't know how to describe it. It's like it's like air bubbles are getting popped kind of inside. Is that
That's a good description. So actually that sound, the cavitation, it's sort of like an air bubble. Think of if you ever go swimming in the pool or the lake and you hold your hand on top of the water and there's that surface tension to where if you lift up really fast, the water kind of comes with you and then releases down. If you tried that. That's actually a cavitation where it's a pressure change that eventually the pressure dissipates and falls away. Something similar is happening in the neck when the joints and the joint capsule are stiff and we add motion to it, there's a rapid change in the pressure inside the joint. Let the head just rest right onto my hand. It's a little bit lower. So you want to use my hands just like a pillow. Good. This is called the cervicothoracic joint. I'll lean to the side. Comfortable there? Good. And this. Okay, now I'm going to press right in on these muscles. Fully let your head rest on my hand. So this is the top of your rib cage, it's the first rib. And I'm pressing into a muscle right here called a scalene muscle that ties your neck and your shoulder together.
okay?
Fully let everything rest. Good. So when we go through some of our exercises that focus on breathing, part of that is getting your breath controlled a little bit lower, diaphragm breathing, so that you're not using this scalene muscle to lift up the rib cage during your breathing. Is that pressure okay?
Yeah, this side is definitely definitely feel discomfort.
Yeah. Is it tolerable? Meaning.
Yeah, that's tolerable.
And if I ease off of that, does that go away?
Yes.
That's perfect. So most of these tissue spots that we're going to be treating, they're called TSI, or targeted structural interventions. We're essentially pushing into where multiple muscles are intersecting on the connective tissue where there's limited motion. And when I create pressure and cross fiber manipulation on them, they are going to change over time. So it'll start sensitive, maybe like a 4 or 5 out of 10. Then it should ease up a little bit as we're going through it. Is that getting any easier yet?
Yeah, definitely a little bit.
Okay, I want to add to this, since there's still a lot of tension. Take your right hand, palm up on the table, and go through a nice slow snow angel pattern. So you're going to bring your arm out to the side, and right around there you can bend your elbow, let your hand continue to move up towards your head here. It's kind of like this goalpost position.
Okay.
And then back down to the side. That's good. Let's do a few more there. Good, back down to the side. Let's keep the arms straight just a little bit longer when you're going out to the side. Keep going, keep going. All right, and nice.
I felt a little pop there.
Yeah, that can happen. 2 more reps there. One more rep. Okay, that's great. You can let that rest.
Kind of felt that shoot a little down my lat.
During that motion, or is that still going on?
No, during the motion.
Okay.
Like while you were pressing against it.
Yeah.
Is that normal? Or?
That's pretty normal. It's dissipated now?
Yeah, it's good.
Okay, yeah, that's called a trigger point referral. So that's pretty common. Okay, John, I'm gonna step out now. I'm gonna send Katie in. She's gonna continue with some of this soft tissue element of your care.
Okay.
And then after that, you're gonna go into some rehab.
Okay, cool.
You wanna stand up and move around a little bit, see how the back's feeling right now?
Yeah, sure.
Did you start paying attention to that mid-back in terms of that being a stiff area after our exam?
Yeah, I definitely noticed it more.
Yeah. Yeah.
Definitely could feel a lot of the tension.
Yeah.
I was also looking in the mirror and seeing, you said the turtle shell thing.
Yeah.
I was looking in the mirror, especially when I go to touch my toes. It's crazy.
Yeah, it stands out.
Yeah.
But that's something we're going to be working on, both in the mobility of the hips and in the back. So you should see some change.
Okay, cool.
Cool. I'll send Katie right in. So we started with mobilizations. One thing I didn't get to so far is going into hip mobilization.
Okay.
So if we want to add some mulligan or hands-on hip mobilization, especially for his right hip, we can, and then we'll follow that TSI plan.
Perfect.
Cool. Thank you. All right, we'll see you next time, John.
Cool. Thank you.
You're welcome.
Little hip mobilization there, and then we're gonna do some more soft tissue stuff. Get everything moving well. I'll have you go face up to start here. How's your day going?
It's good. Just going,
It's going. It's a Monday, right? That's how it rolls.
I've never been adjusted before, so that felt interesting.
It's weird, isn't it?
Yeah, especially my back. It was
It's a weird feeling.
yeah.
So for the hip, usually we kind of just do for adjustment wise. You're not gonna get that kind of sound or anything like that. Usually, obviously you get in the spine, but you might feel a little the joint kind of gapping, so you'll feel kind of a little space kind of coming in there. So we kind of use a long axis kind of distraction is what we mean, just to kind of get more space in that joint. Can kind of help everything feel better there. So I'm just feeling how this is feeling here. Can I have you scoot this way
Yeah, sure.
here? There's left hip that's kind of been bugging you here.
Yeah.
You can just relax this now here. I'm just kind of feeling how everything is. A little stiff that way, huh?
Yeah.
All right, so I'm just gonna you can just feel a little gapping probably here. Nothing crazy though, I promise. Okay, one more. Good. You can go back on the table.
Should I be breathing a certain way when?
Whatever's comfortable, relax.
Okay.
Definitely don't hold your breath and tense up,
Yeah.
but just nice, easy breaths.
Okay. Cool.
Last thing here is I'm just going to kind of give overall leg a little pull here. So and you might feel something in your ankle as well, and maybe a little gapping in the knee,
No
but
worries.
nothing too crazy here. So okay, one more here. Good. All right, you can kind of scoot back up. We're going to do some soft tissue now on that shoulder. So what's been going on with this? Just kind of.
It's like a dull pain almost when
Okay.
I make contacts with something, and it feels like kind of, ever seen a cartoon how
someone's bones break and it like folds up.
Oh yeah.
Yeah, that's kind of how it felt.
Okay.
So I don't know, for pretty much the last year or so.
Was there like a injury or anything, or is it just kind of slowly kind of?
I dislocated it when I was a kid.
Okay.
That was like a while ago. So I probably just like left, I just didn't heal it properly, didn't recover properly. And yeah, so now I have that problem.
All right, so spot we're going in right here. It's kind of all of our soft tissue points are kind of fascial intersection points between two muscles. So this one kind of working, it's kind of the front side here. It's just kind of the front side of your deltoid, which is kind of that muscle that covers the shoulder there, and then your biceps as well. So how's the pressure there? If it gets too much ever, just let me know.
Yeah, no worries.
I always like to tell people from a scale of 0 to 10, kind of discomfort. Never want it getting more than like a 6 or a 7 on that scale. So if it's a little uncomfortable, that's okay. But if it's...
I'm not feeling much discomfort there, to be honest.
You might not.
Yeah.
Some of our spots are more tender than others, so.
There's more discomfort there, but it's tolerable.
Good. Okay. Feels better. Now we're gonna kind of just move over here, lateral part of the arm. This is just again kind of working in the deltoid there. Pressure okay? We usually like to hold these spots for about a minute. Sometimes they need a little longer, but depending on.
Are you pushing it into the side? Like, what does this necessarily do? I'm just wondering.
Yeah, so it's kind of, like I said, like on those fascial intersection points. So it kind of helps the muscles around kind of relax. And then we do this too before you do your therapy, because it kind of enables us to be putting you in the best position possible to kind of have more of a change from that rehab. So, but I kind of am just using we usually use the kind of bony structures as kind of the backboard that I'm kind of pushing up against here, so.
Yeah, it makes sense.
Next one here, working on that. You just relax. Just gonna kind of working that trap. Pressure okay?
Yeah, that was definitely more prominent.
Yeah. I'm not surprised. This is usually a hot spot for people. But if it gets to that point where it's too much, just let me know.
Oh, no worries. It's supposed to hurt to an extent, right?
A little discomfort.
Yeah.
It doesn't have to, but a little's okay. But like I said, if it's too much, we don't want that either.
Of course. There's definitely more discomfort in that area than the other ones.
Yeah, most people carry a lot of tension here day to day, so that is not shocking. Okay, good with the shoulder one. So I'm gonna have you now flip onto your stomach. Yes. Comfortable there? We're just gonna work kind of on that mid-back now. All right, we're gonna start. Can I use a more broader contact here? Pressure okay? Is it all right? So for this one here, we're actually working on kind of trying to relax a few of the little ligaments that are between kind of the spinous process of your spine. It's a little bumpy part back here. So it feels kind of weird, but this one does.
Yeah.
But that is what I'm doing.
Thank you for explaining.
You're welcome. Yeah, and this hopefully will just kind of allow, if we can get all those ligaments, muscles around here to be moving a little smoother.
Do my arms off the table make a difference, or?
Whatever's comfortable for you.
Okay,
So if you want to have them on your side, right now you're fine.
Oh, okay. I was just wondering if there's like anything anatomically that would.
It'll just kind of change the shoulder blade positioning a little bit, but honestly, right now that's fine because it's giving more space in here. So that works for me.
No worries.
I'll let you know if I need you to move any certain way. Pressure all right?
Yep.
Okay. Again, still just working on those paraspinal muscles. They kind of run parallel up your back, right alongside your spine.
Yeah, those have always been an issue for me.
Yeah, I feel like I carry a lot of tension back here. Yeah, that's why adjusting feels nice, but it also kind of can send an inhibitory response to the nervous system, so that can kind of just calm everything down back here, which is what we want, those muscles to... So we are finished there with the soft tissue. Yep, so you will continue on to work with Liz. She is our rehab specialist here, so she's kind of been told what's going on and what to work on.
We can work like right here and then on the wall. Do you do any foam rolling?
Yeah, I do. I try to at least like twice a week. I don't really have a routine though. I did back in high school when I was playing sports, more organized, but now I kind of just go wherever I'm feeling tight. So lately I've been rolling my hamstrings out a lot and my middle back. My middle back's always popping up when I'm using the foam rollers.
All right, well, let's start then with some thoracic foam rolling. You can show me how you foam roll, and then
Yeah.
we can kind of make some like adjustments if
Cool.
there's some other things that we
Yeah,
think work. But
yeah,
let's start
for
with what
sure.
you know.
I'll like try to target specific areas of my back. So like I'll go in my lower back for a little bit, kind of like that, and then I'll move up, go like that. But and then I'll like lean to the side.
To get more like lat.
Yeah.
Okay.
And then do that on the other side as well. That's pretty much all I know for my back.
Yeah,
I don't really
no.
know too much. And
Those-
then I'll go on my legs, all my hamstrings out, but that's not necessarily what we're doing today. And then my
But you
quads
use
as
kind
well.
of a
Yeah,
similar
and my
thing.
IT band as well.
Okay, that's awesome that you use foam rolling pretty regularly. And at some point, we can kind of go over also like hamstring and quad ones. Let's just kind of refine a little what you're doing for your back. Is
Okay,
that all
cool.
right?
Yeah, no worries.
All
Here
right.
to learn. So.
Yeah. What I want you to do is get back in that position like you were in and have the foam roller across your back, kind of at that like mid back. So not on your lower back, because there's lots of sensitive stuff down there.
You shouldn't be rolling.
Yeah, not necessarily.
Oh,
We're going to
okay.
focus on thoracic. So your thoracic spine is kind of those middle section of your spine. Like you got your lumbar spine is lower, thoracic, and then it goes on up to like cervical spine. I kind of think of it like right near, like towards that bottom, like I think about where my rib cage ends, kind of right around there. A little lower, yep, probably right there. So take your hands and lightly behind your head, but what I want you to do, John, is I want you to bring your elbows up towards the ceiling, and now you're going to lift your butt up. You're going to keep your butt high, and then now from this position, you can just kind of like roll to the top of your back, and then roll back to that midpoint. Keep your butt up high the whole time. Keep those elbows up. That way you get lots of contact. Not all the way down to there. Let's say down to like
okay.
here. Yeah, we do this thing we call a thoracic sandwich. So you can take like 10 up and downs total, so 10 little loops, and then I'll show you a second version. And obviously, depending on how your back is feeling, you can take more or less pressure on your back. I don't know what your foam roller at home is.
Liked ones.
Okay, so you're good with all that sensation. All for this part where we're doing the loops up and down your back, you want to keep your hips nice and high. Yeah. What number are you on? I've lost you.
8.
8, yep, give me 2 more. Good. And then you get into it and you're like, I could do this all day.
Yeah, actually. Feeling good.
Great. All right, so now for the next type, you're going to come, again, about that mid-back position, but this time you're going to keep your hips on the ground.
Okay.
Your hands are going to come up in that same position here, and you're just going to open up your back as far back as you can go. Yep. And then you can kind of come up from that, maybe do that a second time. That's probably the toughest position right there.
What, sitting up or?
No,
that's
this low back.
a
Yeah,
lot
so
of
do
tension there.
one more there.
So let me just straighten it out.
Yep. So over time, John, you'll be able to get a little more extension there. Nice. So now, take this, just roll it a tad bit up. Now you're going to do it again. So it's a little bit higher on your thoracic spine, and do the exact same thing. A little bit easier here. Yeah. And just do that a time or two. The idea is that you do this extension 4 points on your back. So that's 2. So then go move it up just a tad bit more. Now we're at 3. And then just a little bit more up. It's almost like by your shoulders. Really keep those elbows
Should my
up.
shoulder blades be resting on it, or is that too high?
That's okay if they're going to be resting on it. When you bring your elbows in front like this, it creates a nice flat spot across your back, right? Then you can get to that. Yeah.
Oh.
Yeah, no, but that's it.
Okay.
So this is something that would be great for you to do every day. Before or after you work out might also be a good time. So lots of times foam rolling, at least for muscles, is really good before and after workouts.
What's the better before or after, though? Both? Do both? Okay. Sounds good, then.
Yeah. Let's come on over to the wall and we'll do one other thing. Yeah, you can just leave that there. You could do like those 10 little laps up and down your back, followed by the one where your hips stay down, and then do the 10 laps again. We would call that like a thoracic sandwich.
Gotcha.
Today is all about shoulders. So we have an exercise, we call this NZR2. It's a neutral zone of reference. Our body has various positions that if we can find that neutral stance and our brain and body can do it again, it helps us move from a stronger, more stable position, help fix things that feel off and maybe prevent other kinds of issues happen. You're gonna take your hand, we call this kind of a diamond shape, goes against the wall, and I want you to go ahead and put your elbows against the wall also. Let's have you feet, you're a tall fellow, stand a little further back. So you're maybe a 15, 20 degree angle to the wall. A couple of pieces here. Think of where your hips and pelvis are. Imagine you had a belt buckle on. I want you to tip it just slightly towards your chin. If you had a belt buckle on, how would you tip it towards your chin?
Like tipping it up?
Yeah, like say it's right here. A little bit of a pelvic tilt there, right? Good, so that puts your back here in a more neutral position. So you're not now arching your back, you don't have that curvature there. One way to keep this here is breathe low down in your belly. So you're not breathing and stopping at your chest, low down in your belly. It's gonna help you keep this position. Okay, good. Now that's like your base.
Okay.
Now we're gonna build up from there. This is nice position here. I'd like you, if you can move your elbows a little bit higher up, think about, keep them narrow like you had
keep
them.
them
Just
narrow.
move everything up. There we go. I like to think of the creases of my elbow kind of lining up about ear level.
Okay.
Okay, I'm gonna put my hands right here. You wanna kinda roll down this way. Feel that difference, right? Now do that same thing over here. Roll, oh, let's do both at the same time. Yep. Find this position again here. A little flatter here, a little flatter here. There, starting to get there, right? So you're gonna extend from this point of your shoulder. Imagine you're extending right out through your elbow. You can even push lightly into my hand. Keep this nice and rolled down. Do this at the same time, out through there. Okay, good. And we're thinking about dropping this low here on both sides at the same time without moving our back. Right? You're like, I could do it.
Yeah.
It's surprisingly difficult at first, right?
Yeah, actually.
So,
There's a lot of moving parts.
yeah. Keep this nice and neutral here. That's really nice. Shoulders are down and just a light engagement, pushing into that wall. Kind of bring this chin into this, like find your double chin for me. There you go. Yep. And now relax on out of it. Just let everything go sloppy against the wall. All right. And let's go into it again.
Okay.
Ready?
Is this too high or?
Well, let's see. Let's let your head lean, tilt your head towards the wall. Yeah, maybe bring them down a little lower. So imagine your hands are about an inch or so above your forehead.
Okay.
Yep. You're gonna think about breathe low in that belly, slight pelvic tuck there, right? Yep. And then shoulders, you wanna open both at the same time. This way.
That's definitely the most
Rolling them
difficult
down.
part, is keeping them both open.
Yes. Push my finger out a little where it's pushing against your back. There you go. Extending from this shoulder point out into the wall a little. It's hard. Yeah. A couple of low breaths into your belly. So you're a little rounded here. I want you to put this where my fingers are touching you towards the wall a little bit there. There you go. This comes out a little.
Out?
It's hard. Yep. There you go. And open here. And open here. Your arms are long. I'm going to change this angle right here.
Okay.
And right on the other side. Yep. That's starting to get there. We're teaching your body that you don't have to do everything from up here, right? So you got these muscles here and here. They kind of help, they connect to your shoulder blade. They kind of help hold them in place, help you move from your core, from your center more. That's better. All right, now relax on into the wall like this. Don't even move your hands. Just let your head collapse on in. Let those shoulder blades collapse and then pull on out into it again, John. Tuck here. There you go. Once you find that tuck, you can relax those butt muscles. Just keep it there. Think about opening up right here, opening up right here at the same time, extending into the wall here. Better. Hold that for like 3 or 4 breaths. Don't hold your breath, just take 3 or 4 breaths.
Try to take like really deep ones.
Low in that belly, yeah. And then come up off the wall.
I felt it more in my right shoulder than my left.
Yeah.
Interesting.
So we are presumably symmetrical, but we have
Not
lots of
really.
differences from side to side. Yeah, so that's called NZR2. You can work on that every day. I like to give homework.
Good.
So you got a home exercise plan,
Right.
and we'll start with this as your home exercise plan. So that idea where you go into the wall, then you kind of come off and you kind of reset. You're making your shoulders down. Hold it for like 2 breath cycles. Let's see if you can get like 20 to 30 repetitions of that done in a day.
Okay.
Break it into chunks,
Yes.
probably, unless you want to do it all at once. 30's a lot at once.
Yeah, just staying there for a while.
Yeah, especially when you consider you're holding it for 1 to 2 seconds.
So is it just that and then coming off the
Yeah, let yourself kind of go back into the wall and then go back in and
push
kind of
off.
find that position again. Yeah,
have your shoulders down,
down and open.
hips up,
Yep,
and then
Breathe on your
leaning
belly.
in and breathing through your belly. Okay, cool.
it's pretty easy.
Yeah, I've never done that before, so that was
I'm not
interesting.
surprised.
Based off of how I did it. so-
No, not based off of
Oh
that.
no, it's okay. Don't worry. I feel like any movement is difficult when you don't do it before. Like you have to like unlock that.
Yes,
in a sense,
yes.
so-
This is like finding that foundational kind of support and positioning that is then going to help you out when you're doing bigger movements or when you're involved in working out or your sport. Martial arts. I think
Yeah, I
read in
do
your chart.
boxing and MMA.
Yeah, having that shoulder stability and strength and support is really important for the things you like to do. I mean, it's also important for life. But
Yeah, eliminate discomfort
Yeah.
on the day to day.
Yeah.
So yeah, that makes sense.
Yeah. All right. So you're going to do that every day and then some of that thoracic foam rolling just so we can start working on some extension through your thoracic spine.
Okay,
Yeah.
gotcha.
Awesome. That's nice to meet you.
Nice to meet you
That's
too.
all I got for you.
Thank you.